what would happen if we brought some of the best universities in the country to the table and got them to really listen to the needs of healthcare, to come off their campus, like the one I'm on today with our partner DePaul, and into healthcare, the actual healthcare environment, to collaborate with leaders from across healthcare, from finance to facilities. Then the idea was, what if we could deliver the result of that collaboration in short, focused upskilling programs, not just degrees, but also degrees, so that everyone had what they needed to excel. And what if we did it so we could reach anyone, regardless of their location, rural or urban, but do it in a high quality and an experiential online format, not the plain Jane online that so many are doing today. And so when I heard this, my mind immediately started imagining the possibility of someone in a rural area proudly holding a certificate from a well-respected school, like you see on the screen right here, or someone really valuing their education because it reflected the issues that they were facing on the job today. And it was intriguing and to me a worthwhile cause, and so I jumped on board. And now here we are with 9 highly respected academic institutions in doing just that. They're coming to the table, they're listening to the needs of healthcare, and they're co-designing customized solutions for you. And so that's what I want to share with all of you today, the work that we're doing to increase access to high-quality learning across healthcare. So a quick bit about me, the guy that you'll have so graciously agreed to listen to for our time here. I've spent my career in online education, and in particular at the intersection of learning science, technology, and instructional design, and leveraging the best of those fields to create less boring and more impactful online learning experiences. It's my personal mission to bring about a better online experience to the world. And since I'm the learning guy, today we're going to focus a lot on the pedagogy and the technology that we leverage in our approach to bring you the absolute best. And so I want to start first by understanding a little bit about you. So we're going to run a quick poll. So if on your screen, you'll please respond to the questions. I just want to get a feel for which programs and you're interested in, and also how experienced you are with online courses and what your thoughts were on that. So if you could quickly just respond to that poll that's up on the screen. All right, got some folks responding now. Thank you. Great, great, thank you, thank you. Looks like we have just about everybody responding. I'll give it another 15 seconds or so, and then I'll go ahead and share the results. All right. All right, so I'm going to go ahead and wrap up the results here, and I'll share those results with you. So you see there's quite a bit of interest across many of our different programs here. So we will touch on these programs that are listed here. Also, it looks like it's kind of split between those who have taken online and who haven't, and split on whether or not you enjoyed it. And so thank you for responding to that. It's very helpful so we can tailor this to your needs today. So I'm going to stop sharing those results, and I'm going to jump into the slides here. So I want to start by talking a little bit about the current challenges that we see. So, you know, number one, it's just difficult to get to in-person trainings and programs. You know, it's time, there's travel, there's, you know, complications in scheduling, all those kind of things. We know it's difficult to get people, especially in healthcare with varying schedules, together at certain times. But even if they are able to get together, there's limited access to high quality upskilling opportunities, whether that's coming from internal training departments or the smorgasbord of opportunities that exist out there on the internet. And of those opportunities, the market is largely saturated with for-profit providers. And some of those programs are developed without a lot of academic and industry collaboration. You know, sometimes in higher ed, it's not uncommon to find that folks are developing things on one side of the wall, just on an academic side, not necessarily getting the industry folks engaged in the process. And then there could be a lack of access to top-tier faculty and research at those institutions, which all results in this low sense of pride in the accomplishment of what folks have gone through. And so those are some of the challenges that I think about of how can we overcome these things that face healthcare workers today when it comes to the type of educational programs that are available. And so our solution to that is really straightforward. We first start from understanding the needs within industry. We come from within healthcare. And have access to leaders from across all different domains in healthcare. And we talk to them. We understand what are the needs to upskill the workforce that they have. What are their needs for education and learning? Then we go and we find top-ranked academic institutions to come to the table, listen to those needs, and co-develop a solution that's truly a needs-based educational program that we can then deliver out, but do so in a way that's accessible. So regardless of your location, we deliver a cloud-based experiential learning program so that way you can gain access to that industry-aligned, high-quality academic institution and complete the programs that you need to be successful in the workforce. So some of those partners that we have worked with, or do work with, I should say, are the ones that you see on the screen here. I won't go through all of these. I'll just highlight some of the ones. Duke Corporate Education is ranked #1 in custom executive education in North America. They know leadership development. And so naturally, we've partnered with them to develop leadership programs for healthcare. Thunderbird ranked #1 for a master's in management. Pepperdine ranked in the top 50 in the US. DePaul University, the largest Catholic university, is actually where I'm at today, and American University in the top 100, and then University of Arizona, #5 in the US, and #15 globally for customized executive education. So some very well-respected institutions that know their space, that know the domains that they excel in. And so on the other side of the fence is industry. And these are the types of people that we bring to the table to get their input on what's truly needed in the programs that we design and develop in partnership with these universities. So whether it be chief nursing officers, vice presidents, care managers, RNs to help us shape a nurse leadership curriculum, or whether it be senior vice presidents and chief strategy officers to help us shape an innovation curriculum, whatever it is, we're bringing the folks from healthcare to sit around the table with our academic institutions to get to something that's truly tailored to meet your needs. So that way, what you work on is incredibly relevant. Now, the way that we do that, so the process that our team goes through to ensure that the curriculum is aligned in the way that I'm describing, is that we include the industry at every step of our process, from identifying the need and the audience of the particular program to creating the structure, the objectives, the outcomes, and ultimately the way in which we're going to impact outcomes within the healthcare system that person works for. The learning content, learning activities, and also thought leadership content, which I'll explain a little bit more in just a little bit. And we include them in every step of the way to ensure that what we're doing and what we're designing and developing has their input and their voice throughout. So that we know we're staying on target with what we intended to do. So what does this mean for you? What this means is that you're going to be engaging in programs that are incredibly valuable and incredibly relevant, and that you're not going to waste time in an educational program that doesn't have a return on that investment of time. What I care about in my role is that every single minute you spend learning is a valuable return on the investment of your time. Time is precious. I understand it. I have a family. I know how difficult it is to do anything outside of the normal realm of responsibilities. And so we want to make sure that the way in which we do it is a good return for you. So that's what it means for you. Now let me share a little bit about the learning experience that I've been describing here. First and foremost, everything is incredibly structured. We know that online learners need to know exactly what to do, when to do it, and where to do it without having to spend a lot of time figuring out how to learn or how to get to what they need. And so we structure the pathways around the idea that our learners are busy and that they need to get on task immediately. And so the course I'm going to use as a demonstration today is our Innovation in Healthcare Management course. But this same process that I'm going to show you actually stays true throughout all of our certificates that we offer. When you learn content in our programs, you're interacting in an incredibly engaging format. We don't ever put you through a passive learning experience. We always work to gain your attention, engage you in the learning process, all in an effort to get you to retain the information that you're learning with the greatest chance of it actually sticking for the long run, so that you can utilize that on the job and really truly leverage what you learned to make a difference in your role, in your job. And so I always like to talk about Netflix here. You know, we can all think of the last Netflix documentary we watched, but we can't necessarily think of all the stuff that we learned in it. And it's because it was a passive experience. And so unless we're strategic about how we recall the facts and information that we learned in that documentary, it's very unlikely that it's going to stick for any amount of time after we watch it. And so we're very careful in how we design our approach so that things do stick and you continue to engage with things over time. But then we also know that you need to access your learning anywhere, and so it's mobile friendly. So if you're commuting, you're on break, you're anywhere, you can get to that content in the bite-sized chunks that we provided in and consume the learning that you need. But that's just how you acquire new information. That's just how you get the information in. Now we've got to do something with it. And this is where we have you apply what you're learning in hands-on project-based activities centered around current workforce challenges. So this is where those industry voices that we work so closely with inform us on this is how this topic plays out in industry right now, today, and 2 years from now, and 5 years from now. So folks can truly be applying things in realistic ways, and again, all in an effort to make an impact on the job. And so this is an example of an exercise that somebody would work on in the innovation program. In total so far, we've had students work on more than 2,500 projects, all designed to make a positive impact on their organization and their communities, which is just an incredible accomplishment that we're quite proud of. But all of the projects that we work on are under the guidance of expert facilitation. So these certificate programs, you're engaging with somebody that's an expert from healthcare, somebody that has years of experience in their field and has spent time understanding the healthcare system so that they can provide their expertise and their feedback on your projects. You're getting mentorship and guidance from experts from healthcare, not from academia on these certificates, but from healthcare. So you're getting exposure to some of the top minds in healthcare. And I like to say it's kind of like being able to have lunch with this person every week and just pick their brain on how you can apply what you're learning on the job to make the biggest impact with what you've set out to do. And so you also collaborate with others in this experience, but we do so on a really modern social platform. So it's more like how you expect to interact online today, not like the archaic discussion forums that typically exist in online programs that some of you have probably experienced in your prior learning. So, we engage you in polling and you can throw your emojis in there, add images, video, all the things that you would want to do to be able to truly collaborate in an asynchronous format, which just means that you're not on at the same time as somebody else, and that's okay because you're able to truly interact with them. Much like you do with everybody on social media today, it's asynchronous. You're not always on at the same time. And so we provide you this modern platform to interact and engage with the others in your cohort that you proceed with through the programs. Now, I talked about remembering and retaining what you learn. And one of the things that we know based on learning science is that you have to space recall out over time. And when you space recall of new information out over time, you drastically increase the likelihood you're going to remember what it is that you learned. Many of you probably did this as you studied for exams. And you brought out your flashcards and those kinds of things. We use technology to help you do that because we know that people don't have time to sit down and make their own flashcards now. And so it starts with the interactive, learning presentation that I gave you a preview of a moment ago. We reinforce key points again and again. We summarize information and give you alternative formats so that you can read it after you've watched it, as an example. Then you go on and apply your learning, and then we also reinforce what you're learning through what we call a drip learning campaign or email engagement, so you get opportunities to recall what you learned in prior weeks through a nice simple format, which is email, which is where so many of us in healthcare go to access information. But we space that out over time, so you're overcoming your brain's natural tendency to forget information through what's called the curve of forgetting. So all of that is delivered through digital badges and digital credentials. We want you to be able to hold on to these forever. These are digital credentials that have metadata behind them that can always be verified that you actually did, in fact, achieve this certificate from this school. And you can add these types of things to your LinkedIn profile. And that stays there as a permanent record of your accomplishment. So when you proudly proclaim that you've accomplished, one of these programs and upskilled your abilities, you can put that on LinkedIn and celebrate with all of your colleagues out there in the social space. I loved this post from one of our students where she just looked at it as just a great way to start 2020 by completing our analytics certificate. That is how we approach the learning process and utilize learning science, technology, and instructional design to bring you the absolute highest quality learning experience possible. And so the phases that I walked you through here are what you see on the screen here. First, you acquire new information through these tech-enhanced lessons, increasing the likelihood you're going to retain the information. Then you connect with others through the discussions in a modern social platform where you exchange your knowledge and experience with others, and you get feedback and input from your peers and colleagues on your thoughts in your projects. But then you apply what you're learning on these exercises where you get feedback and mentorship from an expert facilitator. And then we encourage you through post-training implementation plans and guidance to go and use this information on the job. I by chance ran into one of our participants at one of my son's soccer games just this past weekend, and he took our quality improvement program, and he said, I've used the process mapping that I learned in that course 3 times since I finished the course, and he just finished back in October. And I thought that's exactly it. That's transformation. That's transferring what you learn in a program into the job and making a difference and really driving for outcomes. So with that, is a description of how we approach the learning process and what we do to deliver the best cloud-based learning possible. I want to shift gears a little bit and talk about our certificate programs. With our certificate programs, what we consistently heard from industry is that people need access to upskilling opportunities, short focused programs that allow them to improve their skills in different areas that they identify as areas that they want to improve. Healthcare is changing rapidly. Inpatient to outpatient care, all these new delivery models that are emerging, tech advancements, whether it's AI, robotics, or just, being able to leverage data on a grand scale. Regulatory changes with all the craziness going on in Washington, D.C., changes in consumer demands, how the consumer is a much more informed consumer today than they ever have been in healthcare. They turn to their phone first to find out where they're going to get care before they ever step foot out their door. And so all of these things are what we believe is creating the need for T-shaped leadership within healthcare, where there's this need for a broader knowledge and understanding of the business side of healthcare. And obviously deeper skills and technical expertise as well. But both of these dimensions have to grow to be able to truly be ready for the changes that are happening right now, today, within the healthcare space. And so our certificates align nicely with these needs where they're short focused programs. And as I mentioned, they're online and led by an expert facilitator, but they're typically 8 to 16 weeks long. They all vary based on the certificate. I'll go over which ones are which in just a moment. But they only require about 4 to 6 hours a week from you to engage in the program. And in return for that engagement, you can also earn CEUs. And we start these things quarterly so that you can get in and get going on these certificate programs at a convenient time based on the demands of your work schedule and everything going on just in life in general. And then we price them competitively to what's else is out there in the marketplace. And so I'm going to dive a little bit into what these certificates are. Now, we don't have a lot of time to go into depth on these, but there's a lot of information on each of these on our website. We have several folks on the call that we can have follow-up appointments with to learn more about these as well. But I'm going to highlight some of the things that I think are important in each of these programs. And so I mentioned the rapid changes within healthcare and the need for a broader understanding of the business side of healthcare. And, that's true for all levels of leadership. But in particular, we have a program for nurses, and then we have a program for everyone else within healthcare as well. And that's our nurse leadership and healthcare leadership programs that are meant for new and aspiring leaders, but are also great for seasoned leaders that just want to reconnect with their leadership capabilities. And in these programs, it moves you through leading yourself, leading others, leading change, and leading the organization. So you go from understanding, things about yourself and developing personal resiliency to leading others through goal setting, coaching, collaboration, through leading change, understanding specific change models and how to implement change across your organization, and to leading the organization, and even gets into budgeting and finance and those concepts that are often overlooked in internal programs as well. And this is in partnership with DHGE, who I mentioned earlier is #1 in executive education in North America. They know leadership, and they've collaborated with us around the table and all the leaders that I had on the screen earlier to create something that's truly customized for healthcare. As you can see, that's resulted in one specific for nursing and one specific for other types of leaders within healthcare. The next one I want to talk about is with Pepperdine. Pepperdine is known for its decision sciences school and its marketing school. And so naturally we went to Pepperdine to say, to see if they had interest in coming to the table with us as well and designing something around healthcare marketing, helping folks throughout healthcare, not just the marketing department, but helping folks throughout healthcare understand how to leverage changes in marketing to reach consumers that they aren't currently reaching, and to grow the business of healthcare, which is what leaders are often tasked to do within healthcare. And so healthcare marketing, while it's extremely useful for folks within marketing who want to reconnect with current and in-demand marketing strategies and principles, it's also helpful for leaders that just want to better understand marketing and how they can reach new markets. And so healthcare marketing is a 9-week program, and healthcare analytics for decision makers is a program that's also for anyone within healthcare that's interested in learning how to leverage data better in their role. So this is an analytics program that is great for managers, for leaders, for folks that are in analytics departments that might be new to healthcare, folks that are in analytics department that want a more formal touch back on their analytics programs. But ultimately, these programs have a wide audience, and it's about what's important to you and how you want to apply it in your role. So those are our programs with Pepperdine. Those, again, marketing is 9 weeks long. Healthcare analytics for decision makers is 8 weeks long. The next thing I want to talk about is American University. American University, we've worked with around healthcare project management. Every leader we've talked to in healthcare has expressed the importance of managing projects successfully and understanding how to manage them specifically in healthcare, given the complexities of the healthcare environment with matrix leadership structures, being able to lead without direct authority, all of those kinds of things that are just challenges that are inherent in the healthcare environment. And so we worked with American University to put together something around project management, but uniquely tailored to the healthcare workforce. And so that's an 8-week program that also has 16 CEUs as well. And the next one I want to talk about is with Thunderbird School of Global Management. As I mentioned earlier, Thunderbird is ranked #1 for their Masters in Management program in the world. They know management. And so we were lucky to be able to work with them on the topic of innovation. And to be able to understand how to leverage an innovation model to drive changes within healthcare administration and healthcare management. So this is not innovation in healthcare on the clinical side. So this is not about innovation in healthcare on, with pharmaceuticals and those types of things, or leveraging robotics and surgery. This is about innovation in healthcare management, how to drive change within healthcare on the management and administration side. And so it's been so much fun watching the students go through this program and see the real tangible projects that they're putting together and actually implementing within their organizations, again, under the guidance of that expert facilitator. The last one that I'll talk about here for our certificates is with DePaul University. As you can see, I'm with our friends here at DePaul today. And DePaul has the Jaharis Healthcare Law Institute, and they're ranked 15th in the nation. So they know law. And so naturally, we worked with them to create a healthcare law and compliance course where this helps, again, a wide range of folks within healthcare better understand and spot legal risks so they can avoid them, know when to call in the legal department, but just ultimately just better understand the frameworks that they need to operate within as they try and drive change within their organizations. And so that's the healthcare law and compliance course. That one's 8 weeks long and also has 16 CEUs attached with it as well. So that's a quick overview of our portfolio of certificates that we knew folks were interested in that were joining us today. And with that, I want to talk a little bit about, or talk quickly about what our learners hope to get out of their learning. So this is the data from all of our learners as of this month, of this year. 83% have taken these upskilling opportunities to elevate performance in their current role. So we know that healthcare cares about reaching higher heights and achieving more within their roles because they're telling us that in our data. 60% want to grow their network, and 43% want to gain skills and knowledge for promotion. It's just interesting to understand why folks are engaging in these programs. And the question is what's important to you? Why are you interested in these upskilling opportunities, and what do you hope to get out of it? And so with that, I want to pause for a second and just see if there's any questions so far about the certificates before we move on to the degree side of our offerings. So if you do have questions, please put them in the Q&A or within the chat, either one. And I'll just give it a few minutes here so as people find their way around Zoom. And if you don't have any questions, that is okay. All right, Jade. All right, thank you, Jade. The innovation certificate, would that help leaders come together to create a strategic plan? Absolutely. Yes, the entire course concludes with implementing a 90-day plan for the project that you've constructed during the 8 weeks of the program. So yes, absolutely. And part of that is about gaining buy-in from others in the organization, which would also touch on how to bring those leaders together so you actually successfully implement the project that you're working on. Elsa, will we cover costs later? I didn't put costs in here, but we can speak to those costs. Is there a program in particular that you're interested in learning more about the cost? And while Elsa responds to that, I will, healthcare analytics for decision makers. All right, Lindsay, if you can come on and just respond to the cost for healthcare analytics for decision makers for Elsa here.
Absolutely, Elsa. So the cost for the healthcare analytics course is $2,995. And there are different options when it comes to payment. It's completely up to you. We can do payment plans. We can speak to you about that. So at the end of the presentation, my information is going to be on there. So please just feel free to email me and we can go over a plan that's going to work best for you.
Thank you so much, Lindsay. And Jade, you asked about the admissions requirements. So some of the programs have different slight recommendations on what the prior knowledge is for learners coming into the programs. And all of that is listed on our website as well. But it's, again, we do design these for folks in varying positions in healthcare to ensure that it has applicability across roles. And so there often aren't, strict or stringent admission requirements, but we do list what's good to know before you come in on there. All right, so it looks like those are all the questions so far. Thank you so much. The next thing I want to talk about are degree programs. So, what we've talked about so far, the short upskilling opportunities. Now let's shift over to degree programs. So our degree programs what makes our degree programs unique that we do with our partners is that, number one, as I mentioned, we worked with top tier institutions. All the institutions that we engage with, there's some reason we're engaging with them, whether that be their rankings, that an area that they specialize in, they're known for, or whatever it is. And all that is so that you can have pride in your accomplishment. So when you go and tell the world what you accomplished, there is a sense of pride in that announcement, and there's a lot of value in that, and so we're very careful in who we choose to work with and the reasons why we work with them. But it's also because of the networking that exists. When you work with institutions at this level, you're gaining access to networks that will potentially help you for a lifetime. And then you're also engaging in programs where we've intentionally gone out and brought thought leaders in to help bring content into the courses, whether it be video content that we've added to the courses with thought leaders from industry, whether it be case studies that you work on with input from industry professionals, whatever it is, there's a true collaboration that results in thought leadership that is apparent throughout the curriculum. But all of that is delivered in quality online experiences. As I mentioned, that's my passion. And so we work very closely with each institution to ensure we're delivering you the absolute best online experience possible. And as you work through these programs, it's also done in the context of healthcare. So as an example, the Masters in Global Management program that we've worked on with Thunderbird, School of Global Management. So again, here's a lot of the reasons why we work with Thunderbird. They're number one in so many different areas, from the Masters in Management that I mentioned to number one in the number of industry sectors from which students applied, internationalism of alumni. They're just number one everywhere you look. And so they're an incredibly strong school. And this is an incredibly strong program, the MGM program. And so it was just a really great fit for us to be able to say, how can we work with you around this number one ranked program to create something that's truly unique and special for healthcare? And I will just kind of mention Thunderbird is part of the Arizona State Knowledge Enterprise. And so Arizona State itself is also ranked number one in several spots, and of particular importance is number one in innovation. With that, we have worked with Thunderbird to say, how can we take this number one program and make it truly unique and special for healthcare workers? And so that's exactly what we did. So this is a hybrid program where the vast majority of it is done online, but there are 6 credits of it that are done in an in-person practicum where you are working with a health system to apply your learning on real projects. It doesn't get any more real than this. This is what we like to say is a consulting opportunity where you're consulting and applying what you've learned to a real project within healthcare with real healthcare leaders. And so that makes up for 6 credits of this program. But the rest of it is online, and it takes about 28 months to complete, with the next program starting in August. And so if I dive a little bit deeper in to the curriculum, if we think about it, technology, innovation, globalization, all of those things are changing how we all live and work, especially in healthcare, as you all know. And so this program is designed to help individuals meet the needs of those changes from a global perspective. And so you're going to go through the core number one ranked MGM curriculum, which is what you see on the left-hand side, but then also have a healthcare special focus where you walk through healthcare policy and innovation all the way through special topics in healthcare, in addition to that applied learning or practicum project that I mentioned a moment ago. And so this is the course list that makes up those 49 credits of the MGM program, and how it's differentiated between the core and the healthcare focus within that program. But even in the core, we're having Thunderbird's top-ranked faculty collaborate with industry leaders as well. And so even in the core curriculum, there's a healthcare focus and a healthcare application of the core curriculum competencies and how they can be best leveraged and utilized in healthcare. So it truly is a healthcare tailored and customized program. So that is a quick overview of the MGM program. I want to pause there and see if there's any questions about the MGM program at this time. If there are any questions, feel free to chat. Oh, we got some Q&As coming up. Okay. Jade, what are the admissions requirements? Lindsay, if you'd like to take that question.
Yeah, absolutely. Okay, so when it comes to admissions, Thunderbird has made it extremely easy to apply. Everything's obviously online in coordinates with the online program. So you'll be dealing with me when it comes to admissions, and I'll be helping you, through every step of the process. So first off, I like to collect a most current resume. It's really important for us as in admissions to get to know you, so having that is really important. Getting a copy of your official transcripts. Your unofficials will do in the interim until you can actually get them from your previous institution, but it is important to note that they do have to be sent directly from your institution to ASU. We also need an essay, and the essay is a really, really, again, important part. It's your opportunity to share information about yourself, your plans once you complete the program, your personal and professional goals, and it really addresses why you think you're a good fit for this program and what you're hoping to gain from it. And then lastly, we just will recommend one professional reference, and that can be, again, sent directly to me, or it can be uploaded through the online forum. And those are the admissions requirements. So again, you'll see my information at the end of the presentation, and you can feel free to email me, and I'm happy to help you along that way.
Oh, just one moment, Kurt. I think you're muted.
I was, thank you. Thank you so much, Lindsay. Any other questions out there? No? All right, Lindsay's information is on screen. If you want to take a quick screenshot of that or snap a picture with your phone so you have her information. But either way, we will be sending a link out to this recording. We did want to also introduce Tanya, who is another one of our enrollment advisors as well for the certificates. So if you'd like to take a quick snapshot of Tanya's information, you're welcome to do that as well. But again, it'll also be in the follow-up information that you receive. And then we want to just mention that one of the benefits that we provide all of our learners, because we want to make online learning the absolute best it can be, is free access to Regis workspaces. So Regis is the largest provider of co-working space in the world. They have 3,300 locations across 110 countries. So they're just about in every city here in the United States. And so Regis, any of our learners can go into any Regis location and utilize their lounge areas to study as well. So that is one of the perks that we provide our learners. Again, just ensuring that there's nothing that can stop our learners from being successful in our programs. And then also I just want to put a plug in for an upcoming leadership webinar that we'll be having on March 19th. From 12 to 1 Pacific over Zoom, just like this. It's with the National Leader for Clinical Education and Professional Development from Common Spirit Healthcare, which is the largest not-for-profit health system in the United States. And Danielle Germain will be giving us a presentation on March 19th, so I encourage you all to join us for that. And with that, I just want to say thank you all for your time and for joining us today. We look forward to speaking with you further. Any other last questions before we shut this down here today? All right. With that, again, I want to thank you and wish everyone a wonderful evening. Take care.